Hello and welcome back to my channel. Today we're diving into a condition called SIADH, or Syndrome of Inappropriate Antidiuretic Hormone Secretion. This is a disorder that affects the way your body regulates water balance, leading to low sodium levels in the blood. It might sound complicated, but don't worry. We'll break it down in a way that's easy to understand. We'll go over what SIADH is, the symptoms it causes, how it's diagnosed, and the various ways it can be managed. By the end of the video, you'll have a clear picture of what SIADH is and what can be done about it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. To understand SIADH, we first need to talk about a hormone called antidiuretic hormone, or ADH. This hormone is produced by the hypothalamus in the brain and is stored in the pituitary gland. Its main job is to help the kidneys regulate water balance by controlling how much water is reabsorbed into the bloodstream. When your body has enough water, ADH levels drop, allowing the kidneys to get rid of excess water in the urine. But when your body needs to conserve water, like when you're dehydrated, ADH levels rise, causing the kidneys to retain water. In SIADH, the body releases too much ADH even when it's not needed. This leads to water retention, which dilutes the blood and causes sodium levels to drop. Sodium is essential for many bodily functions, including nerve and muscle activity. When sodium levels fall too low, it can lead to serious symptoms. SIADH isn't a disease on its own, it's a syndrome, meaning it happens as a result of another condition. There are many possible causes, including lung diseases like pneumonia or chronic obstructive pulmonary disease, or COPD, brain disorders like stroke or traumatic brain injury, and even certain cancers, especially small cell lung cancer. Some infections like meningitis can also trigger SIADH. In addition to medical conditions, some medications can cause SIADH. Common culprits include certain antidepressants, anti-seizure drugs, and chemotherapy agents. Even some pain medications like opioids can lead to excessive ADH secretion. Sometimes SIADH occurs without an obvious underlying cause, though this is less common. The symptoms of SIADH are largely due to low sodium levels, a condition called hyponatremia. The severity of symptoms depends on how quickly sodium levels drop. In mild cases, people may not even notice any symptoms. But as sodium levels decrease further, symptoms can become more pronounced. One of the first signs of SIADH is nausea, often accompanied by vomiting. People may also feel tired or weak, and some experience headaches. As sodium levels drop further, confusion and difficulty concentrating can set in. This happens because sodium is essential for nerve function, including brain activity. In more severe cases, SIADH can cause muscle cramps, seizures, and even loss of consciousness. In extreme cases where sodium levels drop too low too quickly, it can lead to coma or even be life-threatening. That's why recognizing and treating SIADH early is so important. If a doctor suspects SIADH, they will start with a thorough medical history and physical examination. Since SIADH is often linked to other conditions, identifying any underlying disease is crucial. Blood tests are the key to diagnosing SIADH. Doctors will check sodium levels, which are typically low. They will also look at blood osmolality, which measures the concentration of particles in the blood. In SIADH, blood osmolality is usually lower than normal because of the excess water in the bloodstream. Urine tests also provide important clues. In SIADH, urine is often more concentrated than expected, meaning the kidneys are holding on to water instead of getting rid of it. This is a telltale sign that ADH is acting inappropriately. To confirm SIADH, doctors need to rule out other potential causes of low sodium, such as heart failure, kidney disease, or dehydration. In some cases, imaging tests like chest x-rays or brain scans may be needed to check for underlying conditions, such as lung disease or tumors that might be triggering excessive ADH release. The treatment of SIADH depends on how severe it is and what is causing it. The main goal is to correct sodium levels safely while also addressing the underlying condition. For mild cases, simply restricting fluid intake can be enough to bring sodium levels back to normal. This means drinking less water and other fluids to prevent further dilution of the blood. Doctors typically recommend limiting fluids to about 800 to 1,000 milliliters per day, but the exact amount depends on the individual case. In more moderate cases, doctors may prescribe medications to help the body get rid of excess water. A common option is a class of drugs called loop diuretics, which increase urine output. However, these medications must be used carefully to avoid changing sodium levels too quickly. Another medication that may be used is a class of drugs called vasopressin receptor antagonists, also known as Vaptans. These drugs block the action of ADH, allowing the kidneys to get rid of extra water while keeping sodium levels stable. They can be effective, but they're usually reserved for more serious cases or when fluid restriction alone isn't working. For severe cases where sodium levels have dropped dangerously low, hospitalization is often necessary. In these situations, doctors may administer hypertonic saline, a concentrated salt solution, through an IV. This helps rapidly raise sodium levels, but it must be done very carefully. Increasing sodium levels too quickly can cause a dangerous condition called osmotic demyelination syndrome, which can lead to severe brain damage. That's why close monitoring in a hospital setting is essential. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, if SIADH is caused by a medication, stopping or switching the medication is often the best solution. Similarly, if an underlying disease like lung cancer or pneumonia is causing SIADH, treating that condition can help correct sodium levels over time. For people who experience recurrent episodes of SIADH, long-term management strategies are important. This often includes ongoing fluid restriction, regular blood tests to monitor sodium levels, and adjustments to medications as needed. Some people may need to take sodium supplements or special diets to help maintain balance. It's also important to recognize the early signs of SIADH, especially for those who are at higher risk. Anyone who experiences persistent nausea, confusion, or unusual fatigue should seek medical attention, especially if they have an underlying condition that can trigger SIADH. For patients with chronic SIADH, working closely with a healthcare provider is key. Regular follow-ups can help prevent complications and ensure that treatment remains effective. SIADH is a condition that disrupts the body's water balance, leading to low sodium levels and potentially serious symptoms. While it can be caused by a variety of medical conditions and medications, recognizing this early signs and seeking appropriate treatment can make a big difference. Treatment focuses on correcting sodium levels safely while addressing any underlying causes. If you or someone you know has been diagnosed with SIADH, working closely with a healthcare provider is essential. Managing fluid intake, monitoring sodium levels, and following a treatment plan can help keep symptoms under control and prevent complications. Thank you for watching. As always, take care of yourself and make the most of your day.